Hi, my name is Edwin, and I am a public health student with Loma Linda University. I, alongside with my teammates John, Andrew, and Stephanie, will be trying to increase the emergency preparedness of one of the free clinics in San Bernardino, the Cornerstone Free Clinic. As part of this process, we had to do a needs and assets assessment before providing any recommendations for emergency preparedness. So I will discuss those right now. So first of all, to go over the needs of the free clinic, um, the first need we could see was that there is not a designated director of emergency response and communication. So this free clinic operates on a weekly basis for only a few hours. So it's open on Wednesdays from about 6 to 9 p.m. every week. And the clinic depends on volunteers to help run the clinic, and most of these volunteers are students from nearby universities, mainly from Loma Linda University. And while there is someone who's generally in charge of the clinic when it is operational, no one is specifically in charge of implementing emergency response or communicating with volunteers or patients were an emergency to occur. Now, second need is a need for a centralized communication system. So kind of going over the previous need of the director, there are many different moving parts of this clinic. There's the physical therapy students or medical students, nursing students. So all these different groups are not really speaking over a centralized communication system, and we believe that it would be important for there to be such a centralized communication system were an emergency to occur. Thirdly, there is no designated volunteer security personnel. There is no person who's in charge of security at the clinic were either an environmental emergency to occur or if one of the patients were to become rowdy or restless or disruptive in any way, there's no designated security person who could take care of that. And lastly, there's no designated evacuation plan or meeting site, either for environmental catastrophes like fire or earthquake, or for an active personnel threat such as a combative patient or an active shooter, anything like that. There's no designated evacuation plan or meeting sites. Um, uh, Lastly, there's no backup generator for the clinic. If the power were to run out, there's no way to get the power back on quickly. Now, so those were needs specifically for Cornerstone Free Clinic. There are other overarching needs that come with working in the San Bernardino community, such as limited medical supplies. There are pretty much all the supplies at the free clinic are dependent on donations. And during a previous meeting with the CEO of the clinic, she told us that there had only been about $40 of donations in the past 2 months, and volunteers were using out-of-pocket money to purchase their supplies. There's also an inability to store medications on site. The clinic does not have the two backup generators which are necessary to store medications according to pharmacy regulations. There are also limited clinical hours. The clinic's only open once a week during certain hours, and this is most likely due to due to volunteers not being able to be available full time, which is understandable.